Hello, I'm Alessandro Napoli. I work at the University of Rome, and we have installed a focus ultrasound system with MR guidance since 5 years almost. Our first application was performed in 2010, and since then we have collected extensive experience, especially in the management of pain, specifically with in patients with bone metastasis and osteoid osteoma. Indeed, I will share with you some experience to let you understand the real potential of this technology in regard of pain management, but also something little bit more than that. And then I will finish with very hot topic, which is the hypertension. So starting from the bone metastasis, this is a very interesting application and very useful actually. It has been approved here in the United States, but also in Europe and Korea, India and Russia. So multiple countries already have the approval for using focus ultrasound for palliative treatment of pain caused by the presence of bone metastasis. In our experience, we treated patients that were refractory to other standard treatment regimens, specifically refractory to external beam radiation therapy, but also to pain medications. In this specific case, we have a lady with large osteolytic lesion on the right hip, and she was experiencing terrible pain. Actually, the day that she came to our attention, she fainted twice because of the pain levels was so bad that she actually couldn't walk because of the pain caused by this lesion. She actually was diagnosed with breast cancer when she was pregnant, and because she wanted other kids, she ended up having total of 3 kids, and then she started to be cured. At that point, the load of bone metastasis was quite extensive, but this lady was very thorough, and she wanted really to be cured. So she received a lot of radiation, specifically in the skull and the cervical spine region, and also in the left hip. So she was with this right hip lesion that was not curable with radiation therapy, and we decided to offer her MR-guided focus ultrasound. And indeed, we had the treatment in a single session, and was an amazing treatment because she could stop pain medication in 3 days after the treatment, and she started to walk again after 1 week. As you can see on the images on the right, there is large deposition of calcium and bone restoration, which means that the patient can walk without any other procedure. Usually when you have such a large lesion which is in the weight-bearing zone, you need to put into it cementum to consolidate the lesion and avoiding the risk of fracture. But with this specific modality, using focus ultrasound, it happens that when you combine with the chemotherapy, you have a good results also in terms of bone restoration. Indeed, the patient, when came to our attention for the second month follow-up, was able to walk by herself and to scale up, come to the second floor using the stairs, because that day the elevator was broken. So a tremendous result. And she was alive for other two years, and that lesion never had a problem again for this specific lady. Here is another interesting case where our oncologist asked to treat a patient with prostate cancer that was treated on the prostate with radiation. Then this patient developed a single bone metastasis on the left hip, right hip. Here you can see the detail of the image. There is a single lesion that was highly getting the contrast of the on this CT PET study, and the PSA at that point was 19. So we treated this patient and trying also to get rid of the entire lesion. Was small enough to be able to have a tumor control locally. And indeed, 6 months after, the PSA level dropped to 0, and there was no evidence of metabolic activity on the PET scan that was performed 6 months after. So a tremendous result with a single session treatment, and the patient really is fully compliant with the treatment that even if requires anesthesia for the procedure, but the fact that they have pain control obtained within few days, and the fact that this is a single treatment and you can perform it during also the chemotherapeutic regimen is very effective for this kind of patient population. Now, moving to osteoid osteoma. Osteoid osteoma is a benign bone tumor that affects specifically the pediatric population. We can encounter osteoid osteoma in older people, but usually is a pediatric disease. It is characterized by huge pain that comes specifically at night. So if you can imagine that these young kids have pain during the night, so they cannot sleep. And since they didn't sleep, the next morning going to school is very difficult for them. Usually this kind of pathology is controlled with non-steroid anti-inflammatory drugs, but they have to take the drug well ahead of the onset of the pain. Because once the pain comes and they take the drug is no longer effective. So they have to have a very good coverage with the drug, which means a lot of drug intake, specifically for this young population. And here is an example of this technology of the focus ultrasound. How can be treating osteoid osteoma? As you can see, there is a lesion deforming the tibia of this 16-year-old guy who had a pain of 9 out of 10. So compromising the quality of life by far due to the presence of this osteoid osteoma, creating also a large inflammatory reaction all over that segment of the bone. We treated this patient with single sonication, which means 20 seconds of energy delivery in a totally non-invasive manner. So no incision, no puncture. There was no need for drilling the lesion. And 18 months after, the patient came back with a pain 0. Actually, the pain was at 0 the very next day and remained 0 till the 18 months follow-up, and it continues to be at 0 up to 2 years so far. Here we have another patient with osteoma osteoid on the finger of the end. As you can see, the patient already underwent surgery, but it recurred a few days after the surgery with really bad pain. This particular guy, he lost 1 year of his school because anytime that he could touch with his finger anything, like he used to go to school using the bus, and anytime that this finger was touching a person or something during the daily activity, the pain was so intense for this boy that he had to go back home and close himself into the door, into the bedroom, and close the windows, close the door, because at that point the pain was so high in level that even the light could cause could increase the pain. So when we saw this this boy, the finger was deformed, as you can see from the picture, and this is the control 1 year later our treatment. So that was a single session treatment, taking 20 seconds of effective treatment time, which means roughly half an hour of the life of this kid, and that result in complete pain palliation, but also in restoration of the bone. Here is the comparison of the image at baseline and 1 year later. And here you can see that the bone was completely clean after 1 year with this totally non-invasive procedure. So there is a huge potential for the focus ultrasound to treat osteoid osteoma. So our clinical experience indicates that focus ultrasound can be safely used for pain palliation in different bone conditions. The procedure is totally non-invasive, and a big point in favor of focus ultrasound is that can be used also during chemotherapy administration, which is very important for the oncology population. And so far we did not encounter any major but not even minor adverse events, and I really think that this is important for a patient perspective, because the treatment is very fast, the recovery is very rapid, and the outcome is quick. So specifically from a patient perspective, this is very important. The last hot topic that I want to mention is regarding the treatment of hypertension. As most of you know, a reduction of few points of blood pressure yields reduction in stroke, coronary heart disease, and also mortality, which means that keeping high level of arterial blood pressure is a dangerous situation, especially for people that are in a condition where are refractory to the different drug strategies. So for that particular patient population, focus ultrasound can penetrate safely the body, reaching the renal artery, because the renal artery has a neural network that somehow controls the systemic blood pressure. Now, the rationale behind the treatment of using focus ultrasound for controlling hypertension is that if we can concentrate enough energy over the arterial wall in the renal artery, we can alter, we can disrupt some portion of the neural fibers, creating hypertension alleviation, which means controlling the blood pressure without any other drug assumption. So this is very interesting in principle, but there has been already out there some clinical trials. So almost 70 patients with resistant hypertension have been treated, and in all of them was observed a significant reduction of the blood pressure, which actually corresponds to much safer perspective of life. So with that, I would like to conclude and take any questions, if any. Thank you.